Good afternoon, everyone, and thank you for joining us today. I'm Dr. Sandra Lowe, Medical Director of the World Trade Center Mental Health Program here at the Mount Sinai CCE, and it is my privilege to welcome you to the second of our three-part webinar on cognitive health. I am delighted to once again be joined by Dr. McBirney-Goc, who is Assistant Director of the Clinical Psychology Program at our CCE, and she has extensive experience in the area of cognitive health. We are very privileged to have her lead this series. So I'll just start with an overview. Over the past several years, many of our program members have begun sharing concerns about their memory, their attention span. So, this series is part of our effort to respond to these concerns and to share our commitment with to letting you know what we know about cognitive health, and also to let you know what are some modifiable risk factors, that is, the things that you can actually change that are going to help support your long-term cognitive health. This series, the cognitive health series, covers three areas. 2 weeks ago, we talked about how caring for your physical health and communicating with your providers is very helpful. 2 weeks from today, we're going to do the same with lifestyle factors and cognition. But today, we're going to focus on how stress and emotional health help shape your cognitive function. So let's take a closer look at today's program. So again, this presentation was really designed with you, the 9/11 responders, in mind. And we hope that we are going to be able to leave you with a better understanding of how stress affects your brain and your behavior. We're going to touch a bit on what changes occur to the brain when it's under prolonged stress, and also note some of the 9/11 related health conditions that are linked to cognitive difficulties. We will speak a little bit about medications and substances and how they can affect your memory and your mood, and leave you with some practical tools to help you manage stress and thereby improve your cognitive health. So the goal is to leave you not just with insight, but also with actionable steps. And the next slide. Okay. So when we talk about cognitive health, we're referring to our brain's ability to focus, to reason, and to make decisions. These abilities are, of course, essential to managing your everyday life. Things like keeping appointments, like handling your finances, managing your medical care and your medications, even staying connected with the community and your friends. However, over the past few years, responders have shared concerns about their cognitive function, trouble concentrating, remembering things, staying organized. These symptoms are quite common. And today we're going to talk about one key contributor, and that is chronic stress. And we're going to talk about that because you can take some steps to improve or manage stress so that it will eventually help with your cognitive problems. So let's take a closer look at stress. Stress is a normal response to the many demands in our life. It's the way our bodies react physically, psychologically, emotionally, and behaviorally to any change in the status quo. And that's because our bodies and our brains love stability, they love predictability. So anything, any changes tend to disrupt us a bit. Um, And which is fine. That is what's supposed to happen. That's why the system is there. Short-term stress itself can actually be protective. So it can be completely fine. It helps keep us alert and motivates us, especially when we're not feeling very disciplined. And it supports survival. That is, it triggers our warning system of danger, what we call the fight or flight response. Talk more about that a little bit later. However, when stress is chronic, when it lingers over time and starts to feel overwhelming, it starts to disrupt our overall health. It interferes with sleep, memory, mood, and it adds to anxiety and emotional distress. For example, if I am constantly worried, on edge, or can't get some disturbing thought out of my head, I have fewer cognitive resources to allocate to important conversations, to remembering to go to my appointments or take my medications, or even doing fun things like being able to read a book or finishing watching a movie. Chronic stress is exhausting, both physically and mentally. And over time, chronic stress alters brain structure and hormone balance and significantly affects our function. So let's take a closer look at what actually happens. This figure shows what we refer to as the chronic stress cycle. It is a vicious cycle. It's self-perpetuating, and it begins with a stress response. Again, this could be a natural response to a stressor, but the stress becomes chronic, it continues, it becomes more and more overwhelming. And when it leaves us feeling overwhelming and sometimes helpless, we try to cope. And one of the ways that we try to cope is to use substances, alcohol, marijuana, cigarette smoking. We also try to cope with this overwhelming stress by isolating or by avoiding things that make us feel a little bit more on edge. These are what we call maladaptive coping skills. They are maladaptive because they actually don't help. And what ends up happening is that the brain remains in this high alert mode. And when it remains in this high alert mode, it does everything we just discussed in terms of disrupting our daily function and our memory. And being in that state further adds to the stress response. So there we go. We're in this vicious cycle of stress. And it can be difficult to break this cycle. It's possible. However, we do need some support. So next, I'd like to take a look at some of the parts of the brain that are affected by uh, stress. Let me highlight that chronic stress, feeling this stress, it's not just a feeling, it's not just an emotion. It actually alters the structure and the function of our brain. What I have here are some of the key areas that are involved in, that are affected by chronic stress. And I'm going to start at the bottom with the amygdala. I have an alarm clock there because the amygdala is actually our alarm system. It detects threat. Whenever there's something that feels threatening, it starts to get very active. It drives our fear response. And when it becomes overactive, more so than it should be, it leads to feeling more anxious and we lose focus, we have less attention. The organ, the brain organ to the lower right, called the hippocampus. This area is really critical in storing and retrieving memory and in helping us learn new things. Chronic stress results in a physical shrinking of this area of the brain. And this leads to forgetfulness and to confusion, and of course, difficulty retaining information. And even the prefrontal cortex at the top left-hand corner, which is often described as our brain's executive center because it's responsible for advanced planning to activities that require a lot of focus, things that are more complicated and challenging. This area in the context of chronic stress tends to become underactive and it becomes less efficient. And what happens is that we end up being disorganized and foggy. So when you put it all together, all of these areas, important areas, and the effects of chronic stress, it's no wonder that we're going to have a lot of problems with our memory. Now, when we look at all this, it's kind of concerning, and it's going to lead many people to wonder, how harmful is this really, and how concerned should I be? So this leads me to talking about normal aging and what's called mild cognitive impairment, MCI. Many members have asked us, is what I'm noticing normal aging, or is this something more? Now, we're all forgetful at times, and an increase in forgetfulness or something forgetfulness that comes and goes is a normal part of aging, unfortunately. And our thinking tends to become slower. So that is considered normal. Mild cognitive impairment, or MCI, on the other hand, refers to a decline in a person's cognitive abilities beyond that which we find in normal aging, but not to the extent of interfering with conducting daily activities. MCI is a degree of difficulty beyond what the cognitive changes that we expect in normal aging. But it is not dementia. It's a signal that we need to pay attention to, and it hopefully prompts us to act. MCI has many causes, specifically some of the ones that we've discussed in our series. And the progression of these difficulties vary from person to person. Some can stay the same, some can really improve with getting care and with making lifestyle changes, which again highlights the importance of this series. That's what we would like to share with you, what you can do. And some can progress to more serious conditions requiring medical attention. So we are going to make some recommendations for things that you can specifically do. And these recommendations are actually helpful regardless of the cause of your cognitive difficulties. So, but in the meantime, and we'll get to that, but in the meantime, keep in mind that the brain is an amazing organ. It is resilient. We use the term neuroplasticity to refer to the brain's ability to change, to adapt, and to recover regardless of our age. It does change. So that is good news. And there are many steps that you can take to support this, to allow your brain to form new connections, to strengthen old ones that are helpful, and even to repair some that have been affected by stress or even by injury. Keep in mind that small steps make a difference. So, before we discuss some of these steps that make a significant difference, I'd like to turn it over to Dr. McBirney-Goc, who's going to first speak about what are some of the conditions that are linked to cognitive difficulties.
Thank you, Dr. Lowe. Sometimes the experience of chronic stressors or other factors contributes to the development of mental health disorders, which are also associated with changes in cognitive functioning. So, for the next few minutes, I'll be providing an overview of some mental health diagnoses that are common in the World Trade Center responder population and symptoms to look out for. For those of you who joined us at our webinar 2 weeks ago, you'll recall that many physical conditions put us at higher risk for cognitive difficulties. The same is true for many mental health conditions. This slide reflects some common mental health conditions that we see at our program, including post-traumatic stress disorder, depression, anxiety, panic disorder, and substance misuse. Some responders notice symptoms of these conditions right after a distressing event, such as after their emergency response work or after receiving a new medical diagnosis. Others may notice them more following a major life transition, such as following retirement. It's also common for members to report that they experience symptoms more at a particular time of the year, such as around the anniversary of 9/11. These conditions can increase your risk for cognitive problems, particularly if they are not adequately treated. Fortunately, there are many excellent resources available for addressing these difficulties. The first step in addressing mental health disorders that may be impacting your cognitive functioning is just to familiarize yourself with symptoms that would benefit from further evaluation or care. We can broadly cluster symptoms to keep an eye out for in the categories of mood, cognitive, behavioral, and physical symptoms. Some of these symptoms may sound familiar, but others you may have been experiencing and not have realized that they can be indicative of a mental health condition. Most of the symptoms we will review are part of all of our experience at one point or another. We all feel sad, angry, irritable, or worried sometimes. However, it may meet the level of being a mental health disorder if the symptoms become more frequent, rigid, and negatively impact your quality of life. Often, when people think of mental health symptoms, what comes to mind for them are what we call mood symptoms, such as feeling sad, guilty, or anxious. People are sometimes less likely to realize that increased feelings of irritability and anger are also common mental health symptoms. As you've likely gathered from the first portion of this presentation, there are additionally many cognitive features associated with mental health disorders. These include symptoms like changes in concentration and memory, or thoughts feeling faster, slower, or just more fuzzy than usual. These types of cognitive difficulties often worsen when our mood symptoms intensify. Cognitive mental health symptoms aren't just limited to changes in memory and attention, although that is one important component. Cognitive features can also include changes in thought patterns or content, such as avoiding thinking about distressing events or having very intrusive memories of a painful experience. Individuals may have persistent negative thoughts about themselves, others, or the world, or even thoughts of wanting to hurt someone else or hurt themselves. The next cluster of symptoms are behavioral changes and patterns that are common when individuals are having difficulties with their mental health. These are changes that friends and family members may more easily be able to observe. Individuals may be more withdrawn and find themselves isolated or find themselves getting into more arguments. Just like it's common for individuals to avoid thinking about painful events, they may avoid places or experiences that remind them of a distressing event, such as avoiding taking trains or changing the channel as soon as a reference to 9/11 comes on television. It's also common for individuals with mental health symptoms to use substances such as alcohol, tobacco, marijuana, or pain medication in greater quantities or with greater frequency. Use of these substances sometimes reflects an individual's attempts to cope with painful experiences, but they can have very detrimental impacts on cognitive functioning and health overall. The last cluster of mental health symptoms to keep an eye out for are physical features, including feeling fatigued or tense, changes in appetite, periods of racing heartbeat or sweating, or even gastrointestinal issues. There can be a great deal of overlap between mental health symptoms and signs of a medical disorder. Following up with monitoring appointments and provider referrals can help clarify the cause of these difficulties. If any of the symptoms we've reviewed here resonate as familiar to you, it's worthwhile to seek a mental health consultation. There are treatments available, and addressing mental health difficulties can better both your cognitive functioning and your overall quality of life. So on the prior slide, I mentioned that it's common for individuals with mental health difficulties to try and cope by increasing their consumption of certain substances. In many ways, this is quite understandable when someone is in emotional pain. They may be looking for ways to unwind or attempting to numb painful emotions. Some people turn to substances to help them sleep. Because substances can sometimes make us feel better in the short term, it can be easy to fall into patterns that are harmful in the long term. There's a lot of data that alcohol, cigarettes, and other substances can have negative impacts on brain functioning, and that's even when they're used in moderation. When you combine substances with other risk factors, like medical conditions, disrupted sleep, or mental health problems, the risk for cognitive decline increases. Over time, this can contribute to slower brain processing and a further worsening of mood and memory. And despite alcohol sometimes helping individuals to fall asleep faster, it actually lowers the quality of sleep and reduces your brain's ability to recover and to consolidate new information. Now, the good news is that reducing use of substances can restore focus, mental clarity, and even improve mood. And there are specialized treatments to help individuals reduce their use, even if abstaining entirely is not of interest. While for many individuals, giving up these substances completely may not be appealing, considering where they can be reduced can have notable benefits for our brains. For example, going from half a bottle of wine with dinner 4 nights a week to 1 glass of wine with dinner 3 nights a week can have notable beneficial impact. It's worth noting that the impact of substances on cognitive functioning is not just limited to things like alcohol, cigarettes, or illicit substances. Next, Dr. Lowe will review some information on how even prescribed medications or over-the-counter remedies can impact cognition.
Thank you. Let's take a moment now to talk about the positive and negative effects of medications on cognition. Now, first, some medications can actually support your cognition. Medications such as antidepressants that are commonly taken for conditions like anxiety or PTSD, as well as depression, can actually improve your energy, your attention span, your memory, and your sleep, which also helps your memory, by treating underlying conditions. It's important to be aware of that and to not avoid medications that have been recommended just because you're worried about potential side effects. Again, some of these medications actually support your ability to think more clearly. Next, it's important to also recognize that there are some medications that can impair your cognitions. For example, there's a class of medications known as benzodiazepines, which are often given for anxiety and panic conditions, among others. Now, benzodiazepines can be extremely helpful. They can really make a difference in someone's ability to function. we can't function well if we're in a state of panic. Benzodiazepines are one type of medication and one type of treatment that can be used for anxiety. Some sleep aids, which of course can be helpful short term. If we're not sleeping, we're not going to be able to function with clarity. So some sleep aids, though, can also contribute to slowed mental processing or actually feeling foggy. And and you need to think about this. There are going to be short-term uses that where it can be helpful, but when used excessively or unnecessarily for long periods of time, it can result in some cognitive side effects. Now, also important is to note that combining medications, even over-the-counter medications. People forget that medications that are over-the-counter or medications that or vitamins, herbal supplements, they tend to think of those as very benign, as not having the potential side effects of prescription meds. However, interactions can occur not only with prescribed medications, but also with these medications. So make sure that you share with your provider all of the medications that you're taking. Take all of your bottles to your next appointment. The provider can take a look at the dosing, who prescribes it, how you're supposed to be taking it, and also talk to you about maybe some supplements that may be interacting with prescription medications. So the takeaway is this. Response to medications is individualized. It should be. Some are going to improve cognition, and others are going to introduce side effects. It's always going to be a matter of assessing risks and benefits. And that is not something that you can do on your own. And fortunately, you don't have to figure it out on your own. Always consult with your care provider if you have questions about side effects or wonder whether a medication may be impacting any function, especially memory. But please do not make any changes in your medications on your own. Don't stop, don't change some medication. First, find out, talk to your providers. We're happy to be able to share that information. Okay, so now that we've covered how stress, conditions, and medications can influence brain function, let's turn to the question that many responders ask, and that is, what can I do to protect my brain health, which is the core of what we're talking about today. And so for that, Dr. McBirney-Goc, would you please share some of the steps that we can take to minimize the harm caused by stress? And also talk to us about how caring for your mental health can also improve function.
Absolutely. Thank you, Dr. Lowe. So we want to go through some steps on what we can do to both take care of our stress management, our mental health, and thereby our cognitive abilities. So we're going to go into lifestyle changes in more depth during our next webinar in 2 weeks, which I encourage you to join if you're free 2 weeks from now on Wednesday from 1 to 2 p.m. However, these daily habits listed on this slide are also very important to review when discussing stress and mental health because they can have significant benefits for our psychological well-being. And as a result, they can have significant benefits for our cognitive functioning as well. So some things to consider as you're trying to build a lifestyle where you're able to manage stress more effectively. We want to try and sleep well. We want to try and maximize our sleep. We, of course, know that a lot of of things can interfere with good sleep. As a good place to start, sticking to a regular schedule, so trying to go to bed at roughly the same time and get up at roughly the same time every day is very important. And really limiting screens before bed is also very important, both because screens kind of activate our brains. They sort of tell us it's bright out, let's be awake. And if we're honest with ourselves, usually what we're looking at on screens before bed is not so good for sleep. Usually it gets us feeling more activated instead of relaxed. So we want to try and avoid screens before bed. Next, we want to try and move daily. How much people are able to exercise, we know that depends on, your circumstance and your physical functioning. But even if you've got some medical problems that you're managing, everyone can find some sort of movement. And if you're not sure what type of movement would work well for you, that's definitely something that you should speak with your doctor about. Even a short walk can improve focus and mood, and also helps with your circulation. And anything that helps with your circulation is going to bring more oxygen to your brain, which is good for your cognition. You want to find ways in your daily life to try and relax your mind. That could be using breathing techniques, mindfulness techniques, finding a quiet time to reset. Uh, for some people, that's some quiet time outside. For some, it's listening to relaxing music. But anything that's going to help you unwind a little bit and rest your mind is important. It's also really important to connect with others. We know that talking to someone you trust reduces stress. We know that when we have social connections, it helps us manage stress better and can reduce the impact of mental health symptoms. Being connected with others is actually a protective factor against cognitive decline. We know that when we're isolated, we're actually at a greater risk for cognitive decline, and the more socially connected we are, the more of a protective factor it is. So it's very important to connect with others. And to consider cutting back on substances. So reducing alcohol, nicotine, and cannabis, or any other illicit substances you may be using is really useful to help protect your brain. As I mentioned before, even if you don't want to cut out a substance completely, finding ways to reduce it can have some pretty immediate benefits. Another step we can take is getting connected with mental health services. So sometimes our difficulties extend beyond normative stress, and stress reduction strategies that we're trying to do on our own aren't sufficiently helpful. It's important to get connected with mental health services if this is the case. One of the ways to do this is to attend your monitoring appointments, where a mental health screening will be offered to you. If you're noticing that you're behind on your annual monitoring visit, you can call 212-241-1554 to schedule. You can also directly request a mental health evaluation through our program by calling 212-241-8462. To give people a sense of a mental health evaluation process, you'll be assessed for common symptoms, and at the end of a process, you'll be provided with some recommendations moving forward. You also want to make sure to share your attention and memory concerns with all your providers and during any evaluations that you do, whether it's a mental health evaluation or a medical evaluation, because sharing your cognitive concerns may have implications for the treatment recommendations that your providers ultimately make for you. So a little bit more on therapy and counseling, because I know some of our members are quite familiar with mental health treatments, and for some they might not know much about it and kind of be curious to learn more. Based on your presenting symptoms during a mental health evaluation, you may be referred for individual or group therapy. Therapy can help both your emotional and cognitive well-being, and it plays an important role in reducing cognitive fatigue. Therapy can provide effective strategies to manage stress and mental health, which will help break the chronic stress cycle that Dr. Lowe was speaking about earlier. This can protect your brain from the detrimental effects of stress to help maintain cognitive well-being. A reduction in mood symptoms is associated with improvements in cognitive functioning. And reduction in mental health symptoms can also improve sleep, which we know is invaluable for the health of our brains. Individuals also find that when their mental health symptoms and stress are better managed, it's easier for them to follow through on medical treatment plans. And if you were here for our presentation 2 weeks ago, you'll know that a lot of medical conditions are associated with a greater risk of cognitive decline. So if you're feeling like your mood symptoms are in better control, you're feeling less emotionally overwhelmed, and that allows you to follow through better on your medical treatments, it's actually just one more pathway to maintaining the health of your brain. Another note on group therapy. Uh, Group therapy offers many of the benefits that I mentioned just now, and it also helps to reduce social isolation, which, as I mentioned before, we know is an additional risk factor for cognitive struggles. So once we're getting more connected with other people, we know that's actually quite protective for our brains. Now, of note, you do not have to be in crisis to benefit from therapy. Some people attend therapy to sort of like maintain the progress they've made. Some people feel like they're kind of coping well enough, but imagine that they could cope even better. And therapy can be really useful for those individuals too. So don't feel like you need to really be in crisis to benefit. There's a whole range of difficulties for which therapy and mental health treatment can be really useful. Now, I mentioned earlier that for some people, particularly when things get very hard, they might find themselves having distressing thoughts or impulses to harm themselves or to harm somebody else. I want to encourage you that if you're having such experiences and you're already connected with mental health providers, it's very important to share these experiences with them so that they can help. If you're not connected to services or you're having these experiences when you can't reach your provider right away, it's important not to wait to reach out for help. And there are confidential resources available 24 hours a day. So by dialing 988 or going to 988lifeline.org, you can reach the Suicide and Crisis Lifeline, which offers confidential services. It's open 24 hours a day and 7 days a week. It's never closed for holidays. If you're really in urgent need of support, it's a good resource to use. So you can also, if you have immediate concerns for your safety or the safety of others, you can also go to the nearest emergency room or call 911 for help. Although having violent or self-harming thoughts or impulses can be quite distressing, there's help available, and it's important to not try to cope with these experiences alone. Okay. So next, we're going to be discussing how different risk factors can interact to impact our cognitive health and offer some guidance on how to set goals to help us to start reducing these risk factors. Our hope is that everybody's going to be able to leave this webinar of an idea of something that feels concrete and manageable that they can do that will be, good for their brain health. So this is just one example. It's a common one, but it's definitely not the only example of how different risk factors for cognitive decline can kind of intersect and reinforce one another. So we can see here in the middle of this slide, we have cognitive difficulties, and we have lots of things that are contributing to those cognitive difficulties. So the boxes on the outside are these risk factors, and we could also see that the risk factors may be reinforcing one another. So for example, let's start at the top. Let's imagine that you're having, some anxiety and depressive symptoms. Maybe they're quite severe. Maybe you haven't gotten treatment yet. You're feeling anxious. You're feeling distracted. Maybe you're feeling quite down. We know that these symptoms are associated with difficulties with memory and attention. So that's that first area from anxiety and depression. We know that those disorders can really directly impact our cognitive abilities. Now, as I mentioned earlier, when we're having mental health symptoms like anxiety and depression, it's not uncommon for us to try and use substances to cope with those very painful feelings or experiences. So perhaps you find yourself drinking more than usual. Maybe you're drinking every day more than you'd like to be, or maybe most days you're not drinking, but when you are drinking, you're drinking very heavily. Now, we know that in the short term, that can sometimes numb some of the feelings, But in the long term, it can actually make the anxiety and depression symptoms worse. So that's why the arrow is also pointing back. We've increased our alcohol use to try and manage our anxiety and depression symptoms, but then we've inadvertently kind of reinforced them and made them worse. And we know that that alcohol use is bad for our brains and is probably worsening the cognitive difficulties further. Now, when we're feeling really depressed, we can get withdrawn from our relationships. I'm now getting to that risk factor in the box on the bottom left of the screen. So maybe we're withdrawn, so we're becoming more socially isolated. Sometimes when we're very anxious, we get a little bit irritable and hard to be around. Maybe that's putting a strain on our relationships. If we're drinking heavily, that can sometimes put a strain on our relationships. And again, we know that strained relationships can make the anxiety and depression worse. It can make us more likely to drink. And we know that being isolated can further contribute to our cognitive difficulties. So, what we're seeing here is all of these different things are interacting and to some degree are all contributing to us having problems with our memory and attention. Now, what can happen when people see this is they can start to feel really overwhelmed because it starts to feel like it's too much to manage. And what we want to do is actually pull back and say the other way to look at this is you have actually a lot of different places where you could start. You don't have to start targeting all of these because that probably feels way too overwhelming. But try to pick one of these arrows. And if you can loosen the impact of one of these arrows, it's going to start to loosen the other ones. So, for example, let's say that you decided that you wanted to try and work on the anxiety and the depression first. You might start in therapy focusing on the anxiety and the depressive symptoms. And it might be that as you develop more coping skills to manage those painful feelings, that you feel better prepared to reduce the degree to which you're having to cope with alcohol. So maybe at that point, you're feeling ready to reduce your alcohol use. And that might also make it a little bit easier to start reconnecting socially with others. Maybe your alcohol use was interfering with some of your social relationships, and then we're reducing the social isolation. So the key here is to, instead of getting overwhelmed by all of these interactions, start to sort of figure out where's one place that I could start? And if I can get the ball rolling there, can I get this sort of snowball effect where addressing that one risk factor starts to make it a little bit easier and a little less overwhelming to start addressing the other risk factors? Now, we know that that's sort of easier said than done. So we have a particular framework for goal setting that we recommend to try and help everyone develop goals that feel meaningful, feel like they could have a real positive impact for their cognitive functioning, but also don't feel too broad and overwhelming. So for those of you who are at our last webinar, the SMART goal framework likely looks familiar. We used it last time to set goals for physical health and is just as effective and important for setting mental health goals. So we know that starting too big and general with goals can be counterproductive by leaving us feeling hopeless and overwhelmed. So we use the SMART goal framework to break things down into goals that are, going by this acronym SMART. So I'm going to go through what each of these letters stand for. So the S in SMART is specific. Very specifically, what do I want to achieve? We want to take something broad and make it much more specific and detailed so we know what we're really setting out to do. The M is for measurable. How will I know when this goal is accomplished? Like, is there a way that I would know to check off the box that I've done what I set out to do? Is it achievable? So part of achievable is this goal realistic to achieve? So part of that is how much we're going to measure, like how big or small the goal is. But the other part of achievable is how are we going to do it? What supports are we going to put in place for ourselves so we can actually do the thing that we've set out to do? The R is for relevant. This refers to, does this seem relevant and worthwhile to you? Now, it's really important that it feels relevant to you, not necessarily to your significant other or to your brother or even to your doctor. It has to feel worthwhile to you because you are the one who's going to have to follow through on it. And particularly if it's a challenging goal, it needs to feel relevant for you to feel motivated to follow through. And the T is for time bound. So when can I accomplish this goal? Ideally, we have like a start and an end date for when we're trying to achieve this goal. You can always extend it later, but if we have just a sense of, I'm going to try and do this soon, or I'll do this forever, what we find is it's really not specific enough and it actually becomes harder to achieve. So we want it to be like, I'm going to do it for the next 2 weeks, starting this date, ending this date. We want that level of specificity. And we can always extend our goals. If we achieve it for a certain time period, we can always extend it later. But if we haven't achieved our goal in that time bound frame that we've set for ourselves, it's actually helpful because it gives us a chance to sort of pause, troubleshoot what went wrong, and then devise a new SMART goal and try again. So I want to give an example of what this would actually look like in practice. So here at the top of the slide, I have what sounds like a really good goal. I will improve my mental health. That sounds great. But if we really think about it, it's very broad and it's not so clear how I'm going to go about doing that. So it's probably going to be pretty hard for me to achieve. So let's translate that into something that's closer to a SMART goal. So first we want to take I will improve my mental health. We want to make it more specific. So let's try I will engage in treatment for my anxiety symptoms. And I want to try to make that measurable. Like how do we actually measure whether or not I'm sort of adequately engaged in treatment to assess to address my symptoms? I'm going to make it measurable by saying I'm going to attend at least 75% of my therapy visits over the next 2 months. That's something I can measure. Over a 2 month period, I can kind of look and say, well, have I actually been attending? Have I actually been doing what I set out to do? And if I've attended 75%, I can check that box. If I'm lower than 75% of attendance to my therapy visits, then I know I haven't actually achieved the goal yet. I'm not there. Now, achievable. So part of achievable is what I'm going to do to help me do this. So part of achievable is I'm going to set reminders on my phone so I don't forget to go to my appointment. And maybe my best friend knows that I've been struggling. I'm going to tell my best friend that I'm going to try and attend my therapy sessions regularly and see if they can offer me encouragement or help me with some accountability about that. Now, part of achievable is also, you'll notice under measurable, I said I'm going to attend at least 75% of my therapy visits. I didn't say 100%. Now, if you can attend 100% as a therapist myself, that's great. I prefer that. But what we find is when we sort of seek out perfection, sometimes people get so overwhelmed they shut down. So, hey, you might be sick. You might be out of town right every once in a while. The 75% is part of the achievable because you're giving yourself some wiggle room that you don't have to be perfect. All right, relevant. Maybe this is relevant because I'm thinking to myself, you know what? I haven't been feeling so good addressing my anxiety and treatment. It's going to be good for my quality of life and it's going to be good for my cognitive functioning. And those are things that are really important to me. And that's how I'm going to stay motivated to follow through on this goal. And our last one is time bound. So I'm going to start tracking my attendance for the months of August and September. So you'll notice I have a specific time when I'm going to start. So I know by August, I'm going to start tracking my attendance. And I know that I'm going to track it through the end of September so that I can assess, did I achieve what I set out to achieve? And if I didn't, what do I need to revise in my SMART goal to give me better luck for the next 2 months? So let's go for another example. Let's say my goal is I will get less stressed out. Again, this sounds fantastic, but it's vague, it's big. I don't know how I'm actually going to achieve it. And it probably sounds like something I could keep putting off if I don't give myself a clear start date. So I'm going to translate that to something more specific. I'm not going to read or watch the news before bed. This is probably going to help in a couple of ways, making sure that we're staying informed with the news, but not over consuming it, can be helpful for mental health. And we know that if we're very anxious before bed, we can't sleep, and that usually leads us to feeling more stressed out. So I'm not going to read or watch the news before bed. I want it to be measurable. I'm going to know specifically how I'm measuring if I can check this off. I'm going to stop reading and watching the news by 9 p.m. I'm going to go to bed by 11 p.m. So I've got a 2-hour window to check off that box. achievable. How am I going to do it? I'm going to set a reminder on my phone for 9 p.m. each night so I know to put the screen away. And I'm going to pick a good book to read instead of, watching or reading the news. Relevant. This is going to leave me less tense in the evenings. That's going to make it easier for me to fall asleep. I know that's going to help my brain health as well. And time bound. I'm going to do this for the next 4 weeks starting this Saturday. So I have a start date and I'm going to measure over the 4 weeks if it's working. If it's working, I'm going to keep doing it. Let's say it doesn't work though. Let's say I'm tracking this and I'm actually finding that having my phone on my nightstand is just too tempting and I'm picking it up and pulling up the news at 11 p.m. each night. I might revise this. It gives me a chance to revise the SMART goal. Maybe that looks like me saying, oh, I can't have the phone by my nightstand. I'm going to start plugging it in overnight across the room from me so it's not an easy reach. And I'm going to try the SMART goal again. So again, if you achieve the SMART goal, that's fantastic and you can extend it and repeat. If you don't achieve it, use it as an opportunity to revise what went wrong and give it a go again. So I'm going to give everyone just a moment or two. Have a paper and a pen nearby. I want you to quickly try to jot down a SMART goal. We'd like everybody to leave here with some sense of something they could do, some goal related to their mental health. So I'm just going to pause while people do that. If you have questions or need help troubleshooting, I'm also going to keep an eye on our Q&A and see if any questions about these goals pop up. Great. So thanks for taking a moment to do that. I know everyone may not have had a chance to finish, but hopefully this gave you a chance to start thinking about something specific that you could try to do after this to assist with your stress management or your mental health. Um, Next, I'm gonna hand it back over to Dr. Lowe, who's going to review some of our key takeaways from our presentation today.
Thank you. So here are some key takeaways, just some brief summaries. The first one is that chronic stress disrupts brain structure and function, especially memory and focus. But remember, you can limit the damage. There are steps that you can take. Next, mental health matters for cognition. Mental health conditions that are untreated really can impact your cognitive abilities. So make sure that you are addressing this with someone. Talk to your provider about getting a referral because treatment makes a difference. Next, we know that alcohol, tobacco, marijuana, and some medications can impair your clarity. However, you can reach out to your providers, ask questions, ask for referrals. It could be your case manager as well as any provider taking care of you because there are resources available. And there are some things that may be able to be done, like modifying your medication management. And the next is that remember that the brain is remarkably resilient and we can take small and consistent actions and that are going to make a real difference. Don't forget the SMART framework. And remember, you are not alone. We're all here to help you. Now, before we conclude, I do want to remind you that this is the second of 3 webinars. Our next one on lifestyle and cognition is on Wednesday, August 13th at 1 p.m. And at that one, we're going to talk about sleep, nutrition, and movement and how they can support your brain health. So we really hope that we're able to see you there. Now, I want to provide some contact numbers and also to thank you for participating in this really important conversation. So, whether you're experiencing stress or memory changes or some other challenges, please remember, talk to your providers, all of your providers. We all work together, we help each other out, and keep in mind that mental health and physical health are connected. Health is health. So there are the contact numbers on the screen. And in just a moment, you should have a feedback link in the chat that we'd love to hear some of your feedback on what you are thinking about the series, what's helpful, what you might want more of. So it'll take just a couple of minutes. Just click on it and fill it out. We'd appreciate it. And next, we're going to just take a few minutes to answer any questions that may have come up. Just going to check the chat to see if there are any questions that are waiting there. One of them is just very quickly has to do with, I've been taking a medication that is really helpful for my condition. However, it makes me drowsy. What should I do? Well, I can just give you general guidance on that one. And my general guidance is going to start with talk to the person who is prescribing it. Maybe sometimes modifications in the way it's taken with food, without food, early in the day, later in the day, splitting dosages. There are a lot of things that prescribers can do to minimize side effects, but it's important to continue medications that are helpful. Okay, I hope that that helps.
Let's see, another question is, I've been feeling more forgetful, but I'm not sure if it's from stress, aging, or something else. How do I figure out what's going on? I think it's a very good question because we know so many different factors can impact our cognitive well-being. Um, I think it can be really helpful, first of all, to start targeting all of your risk factors. You know, using that SMART goal framework, don't overwhelm yourself, but it's not always the case that we can get a direct, this specific thing is causing the cognitive impairment. Often it's much more of a combination. Um, so certainly if you're having sleep issues, if you have untreated medical problems, if you have untreated mental health problems, um, addressing all of those can be really useful. The other thing that I would do is make sure you're telling all of your different providers about that forgetfulness because they might be treating you for something where they think it actually could be associated, or they might pick up on the fact that, oh, I'm prescribing you this medication, but this other one would be equally as good, but has fewer side effects. So one of the ways that you can really start to try and narrow down what might be causing the difficulties is making sure that all of your providers are in the loop about that forgetfulness, even if you don't think the provider is treating you for that. You'd be surprised. So, tell your cardiologist, tell your therapist, tell your psychiatrist, just get them in the loop, and that's going to help kind of identify what the risks for that forgetfulness might be.
I don't see any other questions at this time. Okay. Um, all right. Um, Dr. McBirney-Goc, I think you were going to say something.
Oh, I think there was a question on if somebody missed the first webinar, if they might have an opportunity to get that information at some point.
Yes, actually, these are all being recorded and they will be available on the webpage for the World Trade Center Health Program. And also, they may be available on YouTube for you to take a look at it. So thank you for asking. Okay, I think it's time for us to stop here. Thank you again, everyone. And thank you, Dr. McBirney-Goc, for lending your expertise to our webinar.